Last summer, I spent 3 months in court, being subjected to one of the longest individual inquests in British history. I say subjected because inquests are torturous and re-traumatizing, a slow walk over burning coals which rarely, if ever, lead to justice. It's too late to save our loved ones, and our lives will never be the same. But what drives families to do this is the promise that lessons will be learned, that changes will be made, that it will help prevent more deaths in future. But without a national oversight mechanism, that promise is a lie. My cousin Gaia was a kind, bright, and brave young woman whose struggles with epilepsy and post-traumatic stress inspired her to pursue a career in healthcare. At the age of 16, she reported to Dorset Police that she had been a victim of child sexual exploitation, and within 2 years, she was dead. Psychiatrists mostly dismissed her delusions of sexual assault, and despite recurrent mental health crises and hospitalizations, she spent less than 8 weeks under the care of community mental health services. Gaia's inquest exposed the perfect storm created by austerity and misogyny in the police, social care and NHS, unearthing over 50 opportunities missed by underfunded and undereducated professionals that failed her time and time again. It identified serious flaws in the rape investigation, and mental health experts said that had Gaia not been traumatized by this, she would probably still be alive. We also uncovered shocking failings in the missing persons investigation. Calls Dorset Police initially denied the existence of revealed that the last officer Gaia spoke to, who was not trained to recognise signs of a mental health crisis, had hung up on her, telling colleagues she was, quote, talking absolute rubbish and that she was playing a hoax. When she disappeared hours later, they failed to log her as a missing person or identify her as high risk. The duty sergeant faced misconduct charges because he did not take or order any action to search for Gaia on that first night when she was lost and dying of hypothermia. Even so, Dorset coroner Rachel Griffin banned the inquest jury from even considering whether police failings contributed to Gaia's death. And so ended the investigation we had waited 5 years for. With no hope of justice for Gaia in court, my only comfort was that we had revealed systemic issues which could be addressed to prevent more deaths. And acknowledging this, the coroner wrote to an unprecedented 10 institutions with recommendations for life-saving change. The Royal College of Psychiatrists was asked for better and more joined-up care for people with complex needs, like survivors of sexual violence. Their response was that there is no funding for this. End of story. The College of Policing was asked for better training on physical and mental health conditions, like epilepsy and post-traumatic stress, that might affect someone's behaviour or the level of risk to their life, ignorance of which most often contributes to the deaths of particularly black men in police custody. That was met with outright refusal. Other institutions claim to have made changes, but who is going to make sure that they have? Since Gaia's death, the number of inquests open for over 2 years has tripled, and 2021 broke records for the number of deaths in state custody. Root causes cannot be addressed if they're not even being examined. Instead, repeated recommendations pile high as more families like mine are broken forever by the loss of someone who didn't have to die. If only lessons really had been learned last time around, then Gaia would still be here, making the world a better place just by being in it. That the inquest system is so broken is a stunning waste of public money that endangers anyone who might someday need police or care services because of illness or injury. So this is not a matter of private grief, but of public concern. And let's be clear about the scale of this. Even pre-pandemic, government austerity cuts were linked to at least 130,000 preventable deaths, with some estimates as high as 300,000. The vast majority of these were not even investigated, and the inquest that did take place found over 700 failings, causing over 270 deaths in healthcare settings between 2012 and 2017 alone. Those in power who turned a blind eye to these deaths will be remembered for their complicity in the darkest chapter of post-war British history. The law may be complex, but the truth is simple. As long as inquests only give the illusion of accountability, the state saves face, but our loved ones pay with their lives. We deserve more than the endless drip of damning inquiries and investigations that make no real change on the ground, because the real issue is not awareness, but a shameful lack of political will to make that change. The prevention of future deaths should not be optional. We need independent enforcement to address systemic issues, compel public bodies to effect life-saving change, and provide accountability when they will not or cannot do so. A truly independent National Oversight Mechanism is a vital step towards that, towards a time when, at last, preventable killings are no longer swept under the carpet, and lessons learned will become a practice, not a platitude.